So, welcome back to another edition of the Heart to Heart podcast. My guest today is Dr. Rachael Ross. She's my first MD and PhD on the podcast. I did have one MD, PhD student in Kevin Bass, but Dr. Rachael Ross would be the first one that has both distinctions. So, Dr. Rachael Ross, welcome to the show.
Oh, thanks for having me. I love being firsts, first mean that the experience is going to be magnificent. So I'm excited. Thanks for having me. Thanks for inviting me.
Well,
I follow you. I'm a fan of you. You're outspoken and you speak about all the things that are near and dear to my heart. So I'm excited to be here.
Well, I think you're pretty outspoken yourself, or maybe you sort of tackle some subjects that, a lot of doctors and physicians kind of stay away from. So, I think maybe we have that in common. So, I think
Sure.
it's going to be a very interesting conversation today.
Yeah, I'm
Um,
totally.
so, yeah, before we get started and I ask you questions, can you just tell the
Sure.
audience a little bit about yourself? Because obviously, you're really into men's sexual health. I mean, sexual health in
Yes.
general, I think. And then,
Mhm.
there's also, I know you talk about lifestyle medicine, other things as well, and mental health as well. But, you definitely do have a little bit of a niche in the sexual health area for men. So how did that come about?
Yeah. Yeah, no, so great question. So my name's Dr. Rachael Ross. I was born and raised in a little town called Gary, Indiana. And I am a board certified family medicine physician, a clinical sexologist, and I practice functional medicine. And I try my best to integrate all of that together. My main focus is men's health. And I'll tell you, the men's health piece for me, I started out fresh out of residency doing a lot of prison work. So I was the medical director at a prison in Westville, Indiana. And at the same time, I had like a radio podcast. So I'm in Indiana and I'm doing live radio on a tiny AM station in Miami. And so it was really interesting because I had my main listener, because it came on at this terrible time, it was a terrible dial, were male prisoners. And they would call me and they'd be like, Dr. Rachael, can I shout out to my wife or Dr. Rachael? They is shitty. I mean, it's terrible in here, telling me all about their conditions and stuff. So I think that honestly, my spin for men's health and men's medicine really kind of started in those kind of early days. And it has evolved into this space where for me, I had the luxury of having my dad for 86 years and he was a physician too. And kind of towards the end, he and I spent a lot of time together. And a big part of it is he had been suffering from a really enlarged prostate with a inguinal hernia and ED for years. And he had never mentioned it. He and I had never talked about it. But apparently it had created a lot of issues between him and my mom and a lot of issues for him. And Dr. Mike, if you've ever been, I'm sure you have been around an older person who's kind of, going in and out of mental states, they repeat themselves over and over again. So imagine, here I am spending this time with my dad and, he can't hold his urine anymore, and he keeps talking about, well, when I get out of the hospital, I'm going to have a surgery. I'm going to have a surgery. And he kept referencing between his prostate and his penis and his erections. He just kept talking about it. And I was just like, geez, this is a huge thing for him. And for me, ever since that moment, and then to fast forward to the house, I'm getting his mail. He's on that list. And some of your listeners may have accidentally gotten on that list you get on when you ask for something related to your erections. And then you get on this list and you get every week, you get all of this pornographic / scientific stuff in the mail, like you got these big penises exploding in the face of the women. And, it's like all these things making you want to buy these products. So I saw my dad had invested in some of the products. And so for me, it has been about how can I best help the average gentleman, one, prevent themselves from getting in that position that my dad was in, but also educate them on what to do when you are in that position and how it doesn't have to be all about the blue pill and the this and that there are other all natural solutions. But first, you kind of have to get to the root cause of what the issue is in the first place. So that's kind of the short and the long of how I came to be so passionate about men's sexual health, because besides being a sexologist and a family practitioner and a functional medicine doctor, for a while I was doing everything. I was seeing women, men, this and that and that. And what I noticed about women was when it came to sex, they really didn't want to get much better. It was like they come in with their husbands, they would claim they wanted better sex drive, but they really didn't, and so it became frustrating for me. But for me, guys, when you give them the business and you tell them what they need to do to get better, whether it's their diabetes, hypertension, or whatever, it's just a whole different shift. And that's me. Not every doctor is going to say that about guys, but for me, I have that impact. We connect in a certain way. So that's how I've become this advocate totally for men's sexual health and overall health in general.
That's excellent. I think that it's very interesting though. I mean, I definitely didn't think that it was going to start with, an issue with your father. I thought that, well, I didn't really have an idea of what you were going to say, but definitely didn't think that it would start with your father, which is kind of, interesting. And, it's good that we're talking about sexual health because, it's not just like erectile dysfunction that I want to chat with you about. It's also things like, low testosterone, which can affect,
Yes.
your general health as well. And then also too, like BPH or, enlarged prostates that affects men, severely as well. So, I guess kind of to get into it, what is your overall approach when someone comes in and they say that they have, erectile dysfunction? And I imagine that would be, very different if someone is 25 versus someone who's 65, because I am a physician who does believe in TRT or testosterone replacement therapy, and I certainly test guys' hormone levels. So if someone does come in, like, is that the first thing that you do? Is you give them a blood panel to check all their hormones, or what's your first approach?
Yeah, honestly, my first approach is really a conversation, is really trying to, because I'm a little old school in my practice, and the history and the history, the physical is one thing, but the history, there's so much in the history that by the time I've ordered labs and by the time the visit is over, in my head, I have pretty much decided what I think the root cause of it is, because the history has to do with, is there any trauma there? Are there any environmental toxins that they've been exposed to? Do they sit all day? Do they, are they pretty much in pristine health, take good care of themselves? Do they eat organic? So it's interesting because you have guys who really don't take care of each other themselves who have ED. You have guys who just do everything right who have ED. And so really for me, the most important part, honestly, is going to be the history and the physical, because the labs, sure, I'm a big proponent of testosterone replacement therapy myself. And, there are the inflammatory parameter markers. That's big for me. How's their gut doing? That's big for me. The blood pressure, what medications they're on, all of that. But honestly, the history is kind of, for me, the biggest, light bulb moments in terms of where can we go and how can we customize this to fit what's going on with this particular gentleman.
And what things in the history do people generally mention that you can, easily correct, or maybe not easily correct, but just correct overall, that maybe, quick fixes for people who are struggling with ED?
Man, great question. A big one is their diet.
Okay.
A lot of, you would be surprised. Like, we can debate back and forth about plant-based meals and all of that, but the vegan gentleman who's been vegan for some years, he's going to be in my office. And hands down. And, I get in trouble online every time I mention it, but the vegan diet for most guys, it just doesn't seem to be what God intended them to be on. And so, but also I have guys who go hard in keto, and because they're going so hard in the keto direction, they're not getting the basic nitrates that we need in our diet, right? So a quick fix for that is, okay, if we can't integrate more nitrates in the diet, like if they don't want to make smoothies and they don't want to increase green leafy vegetables, well, what supplements can we put on board that are going to support both pathways of nitric oxide production? Because a lot of guys, It's just basic. You'll listen to the story and you'll say, okay, he's probably depleted. His body probably is not able to make nitric oxide. It's just not doing it. The Viagra's not working anymore. The Trimix isn't working. So that's always the first place I go with that. And it's difficult because we live in a world right now where keto rules. I mean, I think when I was in med school, it was they called it the Atkins diet, so it was protein, and we all
Yeah.
stayed thin because we just ate a bunch of protein and so on and so forth. Well, now with everybody just really focusing on keto, they're trying so hard to avoid anything that they think might take them out of keto that they're avoiding some of the basic veggies that we just kind of need to have the nitrates on board to convert into nitrites and to go through that whole pathway of nitric oxide production. Because let's just be clear, if your body isn't making nitric oxide the way it needs to, you can't get an erection. You just can't. You can be as healthy as you think, but that part missing is a big thing.
So you get nitrates from green leafy vegetables. So, that's obviously something that people should incorporate into the diet if they're struggling with ED and they haven't done that already. I mean, you should be eating green leafy vegetables for a bunch of different reasons anyway. But what other foods, like specifically, like you said, that vegans don't do well with it, and I can't speak for every vegan, but you would imagine that most vegans would have a lot of green leafy vegetables. So, like, what are vegans
yeah.
missing in their diet? Is it like the arginine? Is it like, what is it specifically
Yeah,
that they're missing?
the B vitamins, the choline, they tend to be really depleted in magnesium for whatever reason. Because for every vegan that exists, we have, there's different types of vegans and vegetarians. You have the ones who really are just eating a bunch of vegetables, and you have the ones who are just eating potatoes and soy patties and soy this and soy that. And I honestly feel as though guys really need to be mindful that soy is a phytoestrogen. It is a plant estrogen. We use it a lot in women when they are going through different hormonal changes, for menstrual cramps, for hot flashes. Why in the world would we want a guy taking so much of it? So I find that they'll come in and they're maybe doing a bunch of quick, faster vegan meals like the soy patties, the soya burgers, all these types of things. And that in and of itself is disrupting their hormonal patterns. And then on top of that, they have a tendency to hold on to too much estrogen. So their estrogen levels or their estradiol levels will be a little higher. And some doctors will say, well, we're not going to touch that. We don't want to mess with the estrogen. We do need estrogen. Estrogen is wonderful. It's wonderful for men and it's wonderful for women. But too much estrogen, some guys, means that pathway through liver clearance isn't running smoothly. So what can I do to help rev things up so that they can remove more estrogen from their bodies? Because I feel as though guys who are on the vegan diet, they have a tendency to be retaining estrogen and have too high levels of estrogen, that if we went based off of Western labs, we probably wouldn't even modulate it. But just even doing something like putting them on a little bit of DEM can help push the pathways in the directions that you need them to, instead of making too much estrogen and then holding on to that estrogen and then taking in plant estrogen on top of it.
Okay. And for people who don't know, can you explain
Yeah.
what DIM is? Because I know that it's a pretty popular ingredient in a lot of supplements these days. And from my understanding is it decreases not necessarily, and maybe I'm wrong on this, so correct me, not necessarily maybe total estrogen, but it decreases estrone. So for a lot of people who are listening, they may not know there's three different types of estrogen. So there's estrone, there's estradiol, and estriol. So 1, 2, 3. And so my understanding is that DIM changes the metabolism of the estrogen, or am I
That
wrong?
is absolutely correct. It changes how your body handles and removes estrone from your body, because estrone is going to be the one that's more damaging to the body. But unfortunately, for a lot of men and women, we convert to estrone and it'll just sit there. And if it sits there in the body and we can't metabolize it and can't remove it, then it starts to create a whole bunch of problems, not just hormonal problems, but it can actually fuel certain cancers and things like that. So a big thing is really what's their diet, where are we going with that?
Okay. And before we get into medications, I just want to stay a little bit on the on the kind of lifestyle side, but also on the medication side. So You mentioned magnesium earlier, and I saw that you had a video recently where you were talking about how Nexium or proton pump inhibitors, which are like, very, very commonly prescribed.
The number
Um,
one, number
number,
one.
yeah, I could easily see them being the number one drug prescribed. So that decreases the amount of acid that's being pumped into your stomach, and then because you have less acid, you're not able to make nitrates, which then decreases nitrous oxide, which obviously then will decrease your ability to get an erection. Is that kind of the mechanism of action for that?
Yeah, yeah. So it really, that pathway actually starts in your mouth. So we
Okay.
have the oral microbiome, or the bacteria in your mouth, is designed to kind of activate those green leafy vegetables and those nitrates in our diet, to activate them into nitrites, so that when we swallow them, the pathway has already started, right? So if you don't have the bacteria or the microbiome that's necessary to get that process started, then you can eat these green leafy vegetables and really not have much of an impact on it. So if we can get the oral bacteria to where it needs to be, to the point where now it's activating the nitrates to nitrites, and then it goes down into the digestive tract, and within the stomach, that acid is so important to activate the process even further. And yes, if you're relying on antacids and proton pump inhibitors, what you're doing is you're blocking your body's ability to make nitric oxide. Because see, here's the thing: as we age, our body's ability to make nitric oxide, every decade of life, it just continues to fall off, right? Women lose the capacity much slower than guys do. And unfortunately, that pathway, when we're talking about the endothelial cells and the nerve cells and the nitric oxide synthase that's there to make nitric oxide, that is going to decrease over time. And there's not a whole lot you can do about it. But the pathway that we're talking about, with the oral processing and going into the gut and then it being absorbed, that's the pathway that we actually can control. And so
And can you
that's the
talk a
one.
little about
Yeah.
mouthwashes too? Because I know that there's been
Yes.
some controversy about mouthwashes, how they can adversely affect blood pressure as well.
Absolutely. So, because when we're talking about nitric oxide, Dr. Mike, we got to talk about the fact that nitric oxide is not just about erectile flow. It is the key mechanism to contract and expand your blood vessels. So when it comes to blood pressure, what's happening with elevated blood pressure a lot of times is that the arteries have gotten stiff. And because they're stiff, they can't expand to get the blood. And that pressure increases to get everything through there, right? So what nitric oxide does is it's the gas that needs to be present in order for the arteries to relax and expand and fill with blood. If you rely on the Listerines and the antibacterial mouthwashes, you are knocking out the bacteria that's necessary to support your nitric oxide pathway that happens through oral intake. So one of the first things that we do when we're talking about lifestyle is, are you using mouthwash? What are some of your oral habits? Do you have gingivitis? Because even that can throw off the bacteria. And if the right bacteria aren't in your mouth, then you can't even start that process and get it activated and going.
Okay. And then just to stay on the topic of meds too, like what other medications can cause erectile dysfunction? I mean, I know that SSRIs are a big one, and again, those are very, very commonly prescribed. So what
Yes.
medications might be affecting erectile dysfunction?
Sure. So SSRIs are antidepressants. So most of the antidepressant families, when you get into Wellbutrin, that seems to be one that impacts it less. All of the antipsychotic medications. When it comes to blood pressure medicines, the best ones, the ones that are going to respond least to interfering with erectile function, are our ACE inhibitors, but our beta blockers are really tough on erectile function. Calcium channel blockers are really tough on erectile function, because that whole process of the nitric oxide cascade and CGMP relies on calcium channels and calcium being present. So if there's no calcium, because you've inhibited it with your blood pressure, calcium channel blockers like the Norvasc, verapamil, and all those really wreak havoc on erectile function. Of course, prostate medication, the finasteride that we use for hair,
Yeah.
can
I,
interfere
I'm I'm not a
severely.
big fan of finasteride. So finasteride is Propecia, and a lot of guys take it for hair loss. And I find DHT gets too much of like a bad rep. Like I
I
know it can cause male pattern baldness, and it can cause enlargement of the prostate, but it's also critically important for your overall well-being, your mood. And yet, like, and for people who aren't listening, Rachel just kind of put both her fists up like she's getting ready for a fight. So, it kind of turns
Yeah.
on that sort of like, you know, uh, I don't want to say aggressive mode, but just like motivation and kind of energy to kind of get up and
Yeah.
do things. So I'm not a big fan of finasteride. And actually,
Oh,
um, Andrew Huberman mentioned that curcumin can actually inhibit DHT production as well. And I used to take curcumin, but
yes.
I stopped taking it because I don't want anything to inhibit my DHT. Luckily right now I still have my hair, and I'm not peeing too much at night. So maybe
That's right.
maybe at some point I'll change my mind. But right now, like I'm more or less trying like to maximize my overall DHT levels, just because I know that is fantastic for your overall well-being and your mood. And I think one other one I want to mention there is I haven't looked into it as much, but I think there is some evidence that berberine can do it as well, which is kind of unfortunate because it seems to be like a pretty awesome supplement. It's been as efficacious as metformin for reducing blood sugar
Blood
levels.
sugars. Yes,
So, but
yes.
I have seen that. Is that something that you've kind of, any other supplements or things that I'm leaving out that might affect erectile
Sure.
dysfunction? Or
Curcumin is one of the big ones that I always kind of tell a guy, like, let's lay off of that when they come in. But also, studies show that, when it comes to melatonin intake,
yes.
if you have a gentleman who's been taking melatonin for a really long time, that has a tendency to interfere with erectile function. Now, if you have a gentleman who, maybe has been on melatonin for 2 years or less than 2 years, we actually see that melatonin actually has a stimulating effect when it comes to erectile function. And there's not a lot of science to tell us why that is. But so
Okay.
I also look to see how long has a guy been taking melatonin. If he's been taking it a long time, I ask him to stop because I know that can be contributing to it. And, really looking at sleep patterns, this for a fact. Like if you can get a guy to sleep more than 3 hours, more than 4 hours a night, to me, that seems to be the biggest natural thing I can do to boost their testosterone. Like you'll see testosterone levels even going up 70, 80 points just off of switching that one thing. So for me,
Yes.
making sure that they're actually sleeping, I'm kind of on Dave Asprey's concept with that 6.5 hours is the magic spot when you really look at the data.
Yeah.
And if they're sleeping 9 hours, I ask them, listen, we got to get you moving more. You got to get up. I know you're retired, but we need some activity there. So that in terms of lifestyle, I think that's a big one too. If they're
Yeah.
sitting at their desk all day, I have them set their timer so that every 45 minutes they're getting up and putting themselves in a horse stance.
Okay.
There's great data on horse stance and arm swings in terms of not just testosterone production, but erectile function. And I think the horse stance, I keep trying to figure out what is it about this horse stance, which is
What do you mean
basically,
by horse stance?
yeah, horse stance is kind of a Tai Chi position where you're spreading your legs a little more than shoulder width apart, and you're kind of dropping your butt down, and you're kind of you're just kind of standing as if you're about to mount a horse, right?
Okay.
And what we find with that is not just the Tai Chi position that's associated with increasing testosterone production, but I honestly feel as though it's the whole process of the testicles just kind of hanging and swinging there and just being intentional, and kind of as you're bearing down and you're putting your weight down and you're tucking your butt, that you're actually in some instances kind of doing a little bit of a prostate massage, and you're just kind of encouraging blood flow to that area down there. So for me, we do a lot of things like testicular massage, pumping. We do a lot of things to just wake up an area that maybe has gone to sleep over time. And it works.
Okay.
Honestly, spending a lot of energy telling guys, listen, it's fallen out of favor. It's not working like we want to. So we've got to wake that thing up. I mean, it really is a process of all hands on deck. What can we do to stimulate blood flow? What can we do to rejuvenate the tissue? What can we do to repair from within so that when we get it going, it doesn't just, you're not back in 2 months like, well, I thought it was working, but it's not.
Okay.
And can we get in a relationship going here that you actually are having sex with somebody? That's part of the problem too.
All right. So yeah, there's a few things that I wanna chat about you with there, and I certainly do want to chat about Viagra and Cialis later on. But before we get into those, just sort of like some natural ways. So I was going to ask you about some supplements, and I do want to ask you about that. But you kind of mentioned some like techniques that may be able to help. So when you're saying pumping, like, are you talking about like penis pumps? Like, what are you talking about in terms of like retraining yourself? Like what,
Yes.
like,
Great question. Yeah, I am. I mean, and guys ask me all the time, what pump should I get and what should I do? Honestly, if you don't have sickle cell, no bleeding disorder, you're not on any blood thinners, ginkgo biloba 2 is one that I actually consider to be a blood thinner because it does thin things out a little bit, and you don't have any contraindications to it. You have to think about it like this. So over time, you guys are supposed to be getting 4 or 5 erections a night. Just, whether you realize it or not, it's supposed to be pumping iron while you sleep. Well, as time goes by, environmental toxins, time, nitric oxide production decreases, but also your testosterone decreases. So as a result of that, those 4 or 5 nocturnal erections that you're supposed to be getting are now maybe one, maybe none. And so what's happening is if you're not getting an erection periodically throughout the night, the tissue starts to atrophy, which is just a fancy word for shrivel up and die off, right? So as time goes by, you start to look down, you're like, dang, is that getting a little smaller? Well, yeah, it is, because the tissue is starting to atrophy. So when you think about it like that, it's the same as those abs that we used to use for track. If you're not using them regularly, they will atrophy, they will shrink up, and fat will form around it, and then there'll be a distant memory. Well, the erection is very similar, and it needs blood flow in order to beget and bring blood flow. So with pumping, it's a strategy of actually using the pump, and there's great data that suggests that pumping brings not only growth factors, but it stimulates something called angiogenesis, which is the growth of new blood vessels, and it helps create what we call micro injuries or micro tears to the tissue that actually, we damage a little bit of the skin. Guess what? Now healing factors come to it and heals up better than it was before, right? So that's the whole process behind pumping. And for my guys, I tell them to get like a Vaxaid or a hydro pump that actually uses warm water on top of the air to pump, because not only are we softening the tissue with warm heat, now we are expanding the elastic potential of the tissue. We are creating little micro tears to the tissue so that now we can bring healing while we're going through a rehab program. So, and then on top of that, some nitric oxide boosting supplements to support both pathways of nitric oxide production, maybe some shockwave, maybe a P shot. It just kind of depends on the gentleman. But honestly, pumping is the quickest thing to see outcomes. If you
and
pump.
and and so basically what you're trying to do then is you're like treating your penis like a muscle. Is
Yeah,
that right? And you're saying that like
basically.
if you don't use it, it's gonna atrophy like to some degree, and then I guess not even like maintain its full size or its size that it could be. Is that right?
That's very much true. And
But but I have to ask you this because I know
yeah,
people are going to ask, but
yeah.
it's never ever going to increase your size beyond what you were given, correct?
Well, that's not true, actually. With pumping, actually, the studies indicate, and this is based off of guys who've pumped and their partners, that after, particularly if they're using a water-based pump, that everybody seems to think that there is an increase in plumpness, so thickness, and an increase in size and length. See, think about it like this. the penile tissue and erectile tissue is elastic tissue. And you and I both, we've seen gentlemen and women who have expanded their earlobes to massive capacities by putting rings in it. They put a little spacer in it, then they put a bigger one in and a bigger one in. So they're stretching it. So there are whole communities of gentlemen who are stretching and using extenders and are reshaping their penises. And it's not just folklore. It really does happen. You can even reshape. There are cosmetic physicians who are using not just PRP, but even fillers to help reshape things. So there is a whole lot. There's a whole communities around resizing, reshaping, bringing the mushroom, because the mushroom is the more desirable head shape. So people are remodeling.
I want to ask you about that because literally like 1 minute away from my office, I drive by it every day. There's a nurse practitioner in town. I'll give a shout out to her. Her name is Pinkle, and she's got something that like it's advertised like right by my clinic, like P shot, like get your P shot here. So
Yeah.
what is a P shot?
Great question. So a P shot is using PRP, which is plasma-rich protein, to stimulate regenerative processes within the erectile tissue. So what we do is we take your blood, we spin it out, we get the most potent part of the plasma, and we take it and we and we deposit it into the tissue in certain parts. And then after you've gotten your P shot, we have a tendency to do shockwave first, then we do the P shot, and then all through this process, you're pumping. So
Sorry,
P shot.
what's a shockwave?
Okay, so shockwave is where we're using sound waves, the same devices that we've used for years to break up kidney stones and renal stones and for
Okay.
cardiac rehab. We're actually using shockwave or sound waves to regenerate penile tissue. Well, and this is, maybe they've been doing it with penile tissue for about 10 years now, but shockwave and sound wave therapy has been around for years to regenerate tendons. We use it for arthritis in the knee. Like to me, shockwave is one of my go-tos. I have an amazing shockwave machine in my office, and I might use it on a tendon one day, and the next day I'm using it on a penis the next day. And we're actually now using them a little for clitoral rehabilitation too. So what we're doing when we're doing shockwave and sound wave is that we are breaking up microplaques that have developed within the vasculature. So that just means tiny little plaques that are within the blood vessels and the tissue. And we're using it to kind of break up. We're doing the same thing that we're doing with the pump, where we're creating microvascular injuries or little small tears to help the body start to regenerate and regrow healthy tissue, and to support the process of neogenesis. So I always tell guys who've maybe tried the P shot and it didn't work. P shot works the best if you have a physician that's actually knows for sure that they're harvesting your quality plasma rich protein, that part, but also are the other things being supported as well? Is the lifestyle piece there? Are the nutrients there? Are we doing a little shockwave before we do the P shot? Are you pumping afterwards to kind of help maintain this process? And now, actually, on top of the P shot, we're doing Botox, which is Botox or botulism toxin that you can use either with the P shot or by itself. Because you think of Botox as like, oh, why would you use Botox? Botox relaxes the muscles of the eyebrows. Like, who wants to relax it? We want things stiffer. Yes. Well, it's actually relaxing the smooth muscle tissue in the vasculature of the corpus cavernosum. And so we're seeing such amazing results, even using about 100 units of Botox in the same positions we use it. We're injecting it into the corpora.
So for people who don't really know, what is the corpora?
Yeah, so it's the musculature, the kind of muscle system or the vascular muscle system of the erection. So if you look at
you're injecting it into someone's penis.
Yes.
You're injecting
Absolutely.
Botox into someone's penis and you're getting the results.
Yes.
When did this like come about? I've never
So,
Even heard of
so,
it.
so Botox has been used kind of, it's been kind of an off-label thing, and it's still really off-label. The FDA does not approve it for erectile dysfunction, but I'd noticed a urologist kind of talking about it probably 3 or 4 years ago, and so I've just been like, okay, when is this going to be something that we can wrap our brains around scientifically? When is it going to? And so now we're at the point where they're actually publishing studies. They just recently published a study maybe 3 or 4 months ago that is phenomenal, because let me tell you, when they're doing studies on erectile function, they want to take the guys who are really very healthy, don't have any other problems, just that. This study takes the worst of the worst, the guys that come into the clinic and you're like, you pray, you're like, Lord, please help me help this person, because I don't know, it's going to take you to help, because this has gotten really bad. So they took those guys who have all these chronic diseases, who nothing works. The Trimix didn't work. Nothing was working. And they put them on a regimen where some of them got 50 units of Botox injected into certain spots of the penile tissue, and the other ones got 100 units. For 3 months, the 50 units worked, and for 6 months, the 100 units worked. And I'm talking about 70% of the guys in the study actually were able to get an erection. These were guys who couldn't get one no matter what was happening. So what we're constantly looking for is, okay, we have a guy who maybe the medications don't work anymore, nothing's working. Can we get him to the point where at least the medication can work? At least the PDE5, like the Viagras and the Cialis, the inhibitors, can we get them to the point where at least that works? So that study in and of itself really changed the landscape, so that now Botox for ED isn't just something that we joke about. It really is something that we're using. And so I've done it on 3 guys so far. And I mean, the results it's just like the icing on the cake.
So how have these guys like reacted when you were injecting it? Like, were they terrified for their lives? Like, I just can't imagine someone injecting a needle.
Listen, when your dick stops working, you are already terrified for your life. So they are not scared. They are like, Doc, I've looked at the data. I trust you. Bring it on. If
Like,
this
how
could
big is the
potentially
needle?
help.
Like, how big
Oh,
is
we
the
use
needle?
tiny. So we use it's as tiny as possible.
Like an
Like we're
insulin
using,
needle? Like,
yeah, we're using insulin needles. We're using 22 gauge. I usually use a 22 gauge 1/2 inch needle.
but you're
Um,
not putting lidocaine or anything in before, are you? Or
well, see, listen, some guys want a block, and I will do a block, but I tell you, by the time we've done the block and the pain of the block and all of that, we could have just done the procedure. So, yes, for a lot of guys, I do use lidocaine gel. I mean, for some guys, I have to use lidocaine gel for the shock wave or the sound waves, because the sound waves are tapping up against the tissue, and it does sting a little, and they'll be like, oh, I can't take it. But to me, listen, we're there to wake this area up. We want it to wake up. So we want to hear the sound, and a little bit of smacking is just part of the process. And I discourage the use of lidocaine, but
okay.
if they like that, that's fine. And sometimes I'll use the Cialis spray, just the cold spray.
Okay, and then the other thing you mentioned there too, before we get into supplements and drugs, um, you mentioned filler. So filler, like filler that you put in someone's face, you would in
I don't do it. I don't do
okay,
it, but a lot of my colleagues do it. They are
okay.
using fillers and PRP. Some are using fillers to reshape the erections. There are especially down south in the United States, down south like Mississippi, Alabama, Miami, Florida. There are a lot of doctors and practitioners who are injecting into the fascia to just kind of thicken the process. So they haven't really figured out a whole non-surgical way to give you an extra bit of length overnight,
So
but
they're basically
they
giving
could
you more
definitely
girth by
more,
injecting filler.
more girth. Actually, some of the doctors too will have pictures as to what do you want yours to look like. So they're doing it to the head, swelling the head up so it looks a little plumper and fuller. So yeah, there's a lot being done in terms of cosmetics when it
And
comes to erection.
is this permanent or is this not permanent
So
or
they have to go keep coming back. You know, they do have
okay,
to keep coming back. It's not permanent. It'll last anywhere from 3 to 6 months. And then
okay,
they're back. Yeah, get more
okay.
enhancement. Yeah.
Well, I thought we were gonna talk about supplements and Viagra and that kind of thing a little bit more. So, I know we
Yeah.
have about 15 minutes left, so maybe
Yeah.
I'll get to those questions now. So,
Sure.
yeah, with regards to like supplementation, I think the big ones that a lot of people use are arginine. I think also people use maca powder. Can you kind of speak to the
Hmm.
supplements that you think might be most effective? And obviously,
Sure.
it's gonna, depending upon what the problem is or what the underlying cause is, maybe certain supplements are going to be more effective for people than others. But what's your kind of your overall approach to supplementation?
Yeah, so with supplements, you're right. We do take kind of a customized approach to it. But one thing that's always kind of common is our vitamin D, a D3 with K2. A lot of times guys are loading up so much on vitamin D that that their arteries have become calcified, because
Okay.
so we need that K2 on board. So I'll either switch them to a D3 with K2 or put them on one, because I want their vitamin D levels to be between 60 and 70, ideally for that.
Okay.
Usually everybody's on magnesium. Everybody's usually on an omega-3 fatty acid if they can tolerate it. And then I always want, particularly while we're going through shockwave or this regenerative process, I always want them on and two different nitric oxide supplements. One that's going to support the pathway with the L-arginine and L-citrulline pathway. And then I want one that's going to support the oral pathway of nitrite production. And there's some great ones out there, in terms of that, but I always want them on those two at least. And then for guys who can't
So
tolerate,
which ones would those be? Like if you're talking about it, like
okay, so like Human N makes Neopro 40. It's really expensive, which is a little bit of an inhibitory thing. It's maybe I almost want to say $100 a month for that particular product, but
and what is that exactly?
that is a concentrated amount of beetroot powder. And so they
Okay.
call them super beets. So
Okay.
that is really, we're using that a lot in cardiovascular health. We're using that a lot in erectile health. Um, so that's a good one for oral support. And
I
then,
take it before I do cardio sometimes though. A lot of
yeah,
people use
see, there
beetroot
you
for
go.
cardio because it increases
Absolutely. Nitric oxide
hemoglobin. Yeah.
production.
And it's been like there's very, very few things, unfortunately, that increase your cardiovascular capacity. But that's been seems to be one of the few things that actually does help overall.
That and nasal breathing, right?
Yeah.
Yeah, those two things together can be amazing for a lot of people. So really, you want those pathways supported while they're going through the process, because what we find about like PDE5 inhibitors, like the Cialis and the Viagra, if they can tolerate that, what I'll do is put them on a small dose of Cialis daily while they're going through treatment, because we can talk about side effects all day long, but those drugs actually are in improving the quality of the tissue in some instances. So between supporting the nitric oxide pathway, between doing something like a PDE5 inhibitor or like a Yohimbe, we were using people used Yohimbe before Viagra even existed, but now because
Mhm.
Yohimbe is an herbal supplement, it's been demonized. But to me, it has less side effects and people can tolerate it more. It doesn't have the the vision changes, because now studies are really very clear that chronic use of Viagra and Cialis and Levitra can actually precipitate this process of long-term eye injury. So, so really it becomes about, well,
I
how
think
can I
that's important
support?
just to chat about for a second. I didn't mean to
Yeah,
interrupt you, but a lot of people obviously take these medicines. I know that Cialis 5 milligrams has been approved for daily use, not only for erectile dysfunction, but I believe it's also been approved for the treatment of BPH.
prostate
For
issues.
yeah,
Yeah.
for daily use. So if someone is in a position where like they need to use these medications. And I mean, obviously, again, people are going to be, different and gonna have different requirements. But basically, I think from your approach, it seems to be like you would want to use the least amount of medication for the shortest duration of time. So you probably wouldn't want people to use. You're probably more or less against using Cialis daily. Is that right? Or
I am. I mean, some people are going to need it, and if that's the case, then so be it. But I also find it's really hard to get guys off of Cialis. Like once they're on it and they love it, and you can't talk them off that cliff. But I think that it is a conversation that we as physicians need to be having with patients. That it is very clear that if you chronically are using this stuff, that you run the risk of having a retinal detachment or some other serious issue with your retina that could lead to blindness. And I think that conversation is missing. I also suspect, that there are some other long-term things going on with these medications that they don't publish and they're not talking about, because a lot of times the people doing the studies are the ones who invented the medications and have stock in it. That I just do not like to see guys relying on these every day. And just a personal anecdote. I mean, I used to be the doctor. I felt so cool. I'd keep a box of samples of Viagra. The guys would come in, they're like, "Doc, can I get my samples?" And I would give them to them. And this is just my own personal experience. Both, because my mom was my office manager and she noticed it too. And we just started to notice that those same guys who were hitting us up for their free Viagra all the times were the sickest of the sickest. They would end up with strokes and they would have heart attacks. And so for me, that began the explorative process of what else can we do here other than just pushing these pills. Sure, we may need to use them in certain instances, but not everybody needs to use these. And what other options are there? And so for me, shockwave, the P shot, using your own body to regenerate, the pumping, the supplements is really an homage to some of these guys that I feel like I did a disservice to by just giving without trying to help understand what was the underlying cause and how could we fix that. And so things like the beetroot powder, like you do, those are regenerative strategies. Those help with vascular health.
Okay. And I there's one other thing that I wanted to mention too. I know some people are using, I'm not even sure what it is exactly, but it's a penile implant or something. Is that
Yeah.
okay?
Yeah.
Doesn't seem like you're too big on that. What's
I,
that all about?
well, I'm not huge on implants of any type, like
Okay.
that's just me. That's just my preference. But
Yeah.
what we do as doctors, we give them Viagra, we keep upping the dose. If that doesn't work, go see your urologist. They give you some Trimix. You inject this Trimix into your
What's
penis every
Trimix?
time.
Sorry, I don't.
So,
I'm not sure
Okay,
what this is.
so
Yeah.
Trimix is step two. Trimix
Okay.
is a mix of medications and drugs that we inject into the tissue right before you have sex that bypasses all of the pathways and just goes directly to the penis, and you can
Where
have
do
a
you inject
functional
it?
erection into the tissue. So guys are going home
Into
with
your penis.
syringes, yes, and they're injecting, and then they're going to have sex. So that's a tough process, right? Can you imagine things got so bad that now your doctor's telling you that this is the only thing that you can do for an erection? And I find that those guys who rely on that for a year or 6 months, they're not only, injuring and potentially creating Peyronie's issues because they're getting plaques underneath where they're injecting, but it eventually stops working. So I am a huge advocate for let's exhaust all of our other options before we go to Trimix, and then before some urologist sells you on this idea of a implant, because implants have gotten a little more sophisticated. Sure, they look better and work better.
What are implants exactly though? Like,
So I don't want to demonize implants because I am not a urologist and I don't do them, but they're
yeah.
basically tube-like structures that you implant into your penile tissue that you either activate when you're about to have sex or you want to have sex. You like push a button that's located subcutaneously underneath your skin so that you are kind of inflating it to work. So it's as mechanical as it sounds, but nowadays guys who opt for this, there is a little bit of satisfaction to it.
So you put a tube in your penis somehow through
It's
a surgery, and then there's
surgically implanted.
and then there's a tube in your penis, and then you subcutaneously there's a pump
Activated.
that you can press, and then that basically blows up the tube, and then you get an erection. Is that more or less
That,
how it works?
that is more or less how it works. That
That's
is correct.
insane.
That is
Um,
that is that
that's
is correct.
that's going to extreme lengths, but I guess. But okay, very. I know that there's a couple minutes left, but just one other thing I mentioned, and I only remember this like yesterday when I was thinking about what I was going to talk about today. But did you hear that Ben Greenfield, and some people tell me it's true, some people it's not, but said that he injected stem cells into his dick? Like, is there
Yeah.
any truth about this? Like, why would somebody do that? Like, what are the benefits of it?
Okay, so actually, stem cells are going to be more potent than the PRP is. So, plasma rich protein, if we could all use
Uh,
stem cells for this therapy, we would. But
huh.
now it's gotten to the point where it is actually against the law for us to really use stem cells. So, now
Okay.
what we're doing, because if you, the stem cells are going to be a much better quality than your own plasma. So, if you get somebody who's kind of a sickly person anyway, you're using their own plasma, which may not even be that quality, to get the plasma rich protein to inject for a P shot. Ideally, we would be using stem cells, either harvested from yourself or from a company that sells them to us at a very expensive price, and then we inject those into the tissue, and then you almost have this situation where now you're healing and growing, blood vessels and the tissues repairing, and so yeah, so absolutely, I'm sure that's true. And he's not the only one who's doing that. There's a lot of that going on, and it works. I mean, there's a
Interesting.
lot of guys it works. So
Interesting.
I know we got to go. This has been freaking fun. So thank you
Yeah,
for
no,
having me.
this has been awesome. I'd love to have you back on because there's other
Yeah.
things that I wanted to chat with you about today. I mean, I know I wanted to concentrate on ED, which we obviously did, but I'd like to chat with you a little bit more about hormones, definitely a little bit more about
Yes.
BPH, because BPH
Yes.
is a huge deal for a lot of different guys, and just prostate issues in general, and because sometimes it's hard to tease out whether it's a prostate issue, whether someone's just having overactive bladder.
That's
And I know
right.
there's a lot of different medications and things out there, so maybe we'll have to do round two soon if
Oh, I would love
you're
that.
yeah.
Round two, the prostate. Let's do it. Let's do it. And
Okay.
of course, I got to plug my E Function
Yeah,
Smoothie
yeah, yeah,
Recipe
please
book,
tell
right?
everybody
Yeah,
where they
yeah, yeah.
can find out about yourself. Yeah.
Absolutely. So follow me on Instagram. I have a YouTube channel where we dive deep into this stuff. It's at Dr. Rachel. Make sure you spell Rachel right. It's DrRachael. My E-Function smoothie recipes dedicated to my dad. We've got some amazing smoothie recipes that are changing lives. I just got a thank you note the other day from someone who was thanking me because he actually was able to give birth and have kid, and before his erections were suffering. So they are using clinically proven food items to combine together in recipes that are really helping stimulate the nitric oxide pathway and to decrease inflammation. Those are the two things that we all need to do more of every
Amazing.
single day.
Well,
Yes.
Dr. Rachael Ross, again, thank you so much for coming on the show. We'll definitely do this again
Pleasure.
soon. And thank you so much again, everyone, for listening. And I'll be back again next week.
That's what's up. Bye.